All right, so are you excited for your CoolSculpting treatment today?
Yes, I am.
All right, so I know you expressed some of your concerns before. I know your goal is the midsection. What is it that you're looking for? What would make you happy there?
The area that's always been challenging for me is in the abdomen, and that's the area that I'd always like to, even with exercising, it's always been, just challenging for me in general.
And you mentioned you had a couple children also?
And I've had 2 children, so that's made it a little more
That always
challenging.
makes a little more of a challenge. As you said, what we can pinch is what we can work with. Can we take a look at that area there? All right. So I'll show you a little bit what the template is going to kind of show us that area that we're going to focus on right across there. So is it okay if I pinch a little bit there?
Yes.
All right. So kind of what we can pinch is what we can work with. And so that's kind of the middle right there. We work kind of right across there. Perfect. Good. So that template's going to go right across that area there. And that's going to be kind of our endpoints there. And we'll come up to that area. So that's going to allow us to work right across that midsection area there. You do great. So you're an excellent candidate.
I'm excited.
Very excited. Great. Thank you. Introduce Naomi with us here today. So she is our guest for the evening. She's our live demonstration. So thank you for participating.
Thank you.
So would you like to share with everyone a little bit of what your thoughts
Sure.
are?
Can everyone hear me?
Yes.
Basically, when I heard about CoolSculpting, I thought that I would probably be a perfect candidate for that because I've always struggled, the area that I've always struggled in is the abdominal area. And even with exercising, I just always have that bulge in the abdominal area. And especially after having 2 children, it became more challenging for me to, even after exercising. So when I heard about CoolSculpting, I thought, oh, this will be good. I'm a good candidate. I think I'm a good candidate. Not only I liked when I learned about CoolSculpting is that it's not invasive. There's no recovery time, and there's no cutting of the skin involved, and you can go right back to work the next day. You can just sit there. It seems like it's not going to be bad. Dr. Nowak marked my area.
You want to jump?
Sure.
So her biggest concern is right in this area, so it's really, I'm going to pinch you for a little second here. So what we can pinch, that's what we're going to be able to work and focus on. So we can see how this template would fit right across this area, but really wouldn't fit up in here because this needs to contour around the surface of the skin, but that's why we have other templates that can work in other areas for us. So we're going to be able to work right across that area. We're going to focus on this part right down in here, and that's going to do great. So you got good looking skin, which is the important part, because as we said, it doesn't really tighten the skin. We're going to be able to reduce that area very nicely. So
I'm excited.
exciting. Great. Feel a little bit cool here. There we go. Great. All right, so that's just a cool gel to protect the skin for us. We're just going to smooth that out a little bit. Great. Soaking applicator. And we're going to start the little vacuum there, and we're going to apply that to the skin. All right, so we're going to go right across this area, and a little pressure here. Here we go. All right, you doing okay? All right, so we're going to put this little pillow around just to support it. A little boppy here to help you out there. And how's that feeling for you there? Feeling fine? Okay. So what do you feel there? Do you have your microphone there? You can.
What I felt when he placed the applicator was like a lot of pulling and tugging at the very beginning, but there was no pain, just
No
a
pain at all?
strong, no pain,
Okay.
just a strong pull and a tug.
Okay.
That's what I thought.
All right, very good. So we're going to start the cooling part now. So you're going to feel me start the cooling, which is this part here. So you feel a little cold, and like I said, you'll feel that getting started there. Okay, very good. How are we doing?
We're doing fine.
So that's all there was to the CoolSculpting. It's really more about the setup and isolating the areas and getting everything set and ready to go there.
Start feeling the cold.
You're starting to feel a little
I'm starting
cold?
to feel the cold now.
Okay, great. So you'll feel it get a little colder, and like I said, within just a couple minutes, you'll feel it get cold and it'll be done. So you just relax and we'll be with you in one moment. Okay, thank you.
What I'm most excited about the treatment, obviously, is going to be the end result. I'm excited that it's non-invasive. There's no downtime, no recovery time. There was no cutting of the skin, and it was really quite comfortable for the entire hour that I was here. And I didn't even feel like it was an hour. The time actually went by pretty fast.
Is that what it sucks it up there?
All right, so we're going to remove the little cold gel there. Looks great there. So, some people describe that this looks like a stick of butter there. And it does look a little bit like that. So now I'm going to do a little bit of massage there. So you'll feel like a little tingling sensation there. There we
Is
go.
that frozen?
I do. I feel it's like tingling sensation.
You're going to feel like if you were in the snow and your hands were cold and they were warming up.
And it's very good, yeah.
All right, so now you get to actually meet Naomi here. So she just completed the treatment. You saw me doing a little massage on the areas. We can see the area that's red right in here is the area that we've targeted. So that's kind of right across the middle part of that template. That yellow zone there is the area we targeted. You can see that that corresponds right to the area that she's most concerned with. So you did great there.
Thank you.
Does anyone have any questions for Naomi?
How does it feel right now? Do you feel like numbness? Or?
Right now, it feels cold and numb. Numb, and in some areas numb, some areas cold.
But okay.
Oh, no, I don't.